Good morning. Thank you everyone for joining us this morning. My name is Elena Van Tassel and I am a Deputy Treasurer as well as the Executive Director of the Office of Economic Empowerment in the Massachusetts Treasurer's Office. I'm thrilled to be able to have you join us today to talk about an act helping to close the racial wealth gap. We're going to go over the agenda for today. First, we're going to start off with special remarks by Treasurer Deb Goldberg, and we'll have an overview of the baby bonds across the United States with Chair Markoff, and then we'll be having a panel discussion moderated by Treasurer Goldberg. Before we get into the agenda items, we are going to just go through some housekeeping. Just a reminder, this is a Zoom webinar and it will be recorded. The recording may be uploaded onto a public website for future use. This webinar will also be streamed live on Facebook. Any information shared throughout the Q&A feature will be anonymous. Please note, however, that the chat function is not anonymous and subject to the public records law. Again, please feel free to use the Q&A feature. If we have time at the end, we are going to try to answer as many questions as possible. Just a reminder, this is a webinar and not a meeting. As such, you'll not be able to view the other participants. All right, moving on, I'm thrilled to be able to welcome and introduce Massachusetts State Treasurer and Receiver General, Treasurer Deborah Goldberg. Treasurer.
Thank you, Elena. And in a way, I feel as though, given our incredible speakers today, I'm probably at this moment not the least important person here, but I have to say that I am the person who, when I first heard about baby bonds and the opportunity to attack the very, very basic income inequality that we see in our most disadvantaged communities, I said, this is for us. For those of you who are newer than when I first arrived in 2014, the reason I created the Office of Economic Empowerment was for these very reasons, to give people skills, to give people opportunities, to share information, to build equality, to build wealth. And we have done that in many, many different ways. But when a friend of mine, who was another treasurer in another state, started telling me that he was looking at baby bonds, I immediately asked our policy people to look into what is this? How do you do it? How can you build coalitions and people engaged in what exactly needs to be done to effectuate systematic change? And in fact, several other states have looked at this, have considered it, have looked at varying ways of funding it. But we did it the Massachusetts way, the way we do everything in the Office of Economic Empowerment. We do pilot programs, we do task forces. And one thing interesting about our task forces, which when I convened my first task force in 2015, we brought 32 people into the room because I wanted to know what were the challenges and what were the solutions to giving kids, teenagers, young adults, seniors, the financial skills they need to understand this crazy world. And obviously in the last couple of weeks with what's gone on in the banking crisis, it's really good if you can understand what's going on. And we had 32 people in the room and I said, in 6 months, I would like the conclusions and the action plans. You don't get to graduate, you get to help us get that all done. 22 points later, and we got it all done in a matter of about a year and a half. That's what this is all about. We have done pilots, for example, with our Baby Steps Savings Program. I consider what some of the other states have done, both in hitting bumps in the road and obstacles. That is our kind of pilot program, while we put together a tremendous working group to figure out what's the right approach for Massachusetts. Of course, I turn to two of my favorite dear friends, Senator Feeney and Representative Vargas. It took them less than 10 seconds to say, yes, I want to be working on this. And we are thrilled to have the two of you with us on this path. Great group of people who did a phenomenal task force What we do know is that it's a coalition, that we, in order to achieve this goal of really attacking the problem and helping to solve it, we need everyone to understand what needs to get done. And that's why we're going to have events such as this to bring people together so that they can hear just how effective this can be. But it's also going to take everyone to jump in and help solve the problem. So with that, I want to turn it back to you, Elena, and let you begin with Shira's presentation on the status of baby bonds across the country. And then we'll follow up with my fabulous panel of Dr. Derek Hamilton, David Radcliffe, Senator Paul Feeney, and Representative Andy Vargas. Please take it back.
Thank you so much, Treasurer. I'm excited to introduce our first speaker. We're very lucky today to have some nationally regarded speakers on the topic. And the first one is Shira Markoff, who is a senior policy fellow at Prosperity Now. And she's going to share more on what Treasurer Goldberg just talked about baby bonds and what's happening nationally. So Shira, I'm going to turn it over to you.
Great. Thanks, Elena. Thanks, Treasurer. So yeah, I'm going to start with giving you a broad overview about baby bonds and what's happening across the country. But I do want to start on the next slide by kind of starting with the story about why baby bonds are needed with something we can hopefully relate to, which is playing Monopoly. So imagine one day you're playing Monopoly. As you all know, the rules are that everybody starts with the same amount of money from the bank and nobody owns properties when you start. But let's say for some reason on this game, one of the players gets to start out with triple the amount of money of everybody else, and they already own properties on Boardwalk and Park Place before you even start, before anyone even rolls the dice. I think it would be fair to say that most of us would say that's a really rigged game and we don't want to participate. But if you think about it, that's actually very similar to the world we live in. So there are some babies who start out life way ahead of the game because they're born into wealthy families. And when they become young adults, they're likely to receive financial support to start their lives, like college tuition or money towards buying their first home. And that gives them a jump start on their future. And then there are other babies who are born way behind the game, who are born into families without wealth. And disproportionately, these babies are Black or Latinx. And when they become young adults, they don't have that family money to be a springboard for them. And it's a lot harder for them to get started in their financial lives. And so that's really where baby bonds come in. So baby bonds are about changing this reality so that every baby, regardless of the family that they're born into, that family's financial situation, they have a nest egg for their future to help them reach their full potential. So on the next slide, you can see a little bit more about specifically what baby bonds are. So baby bonds are essentially a government-funded trust fund, with government setting aside money for kids, particularly focused on those whose families don't have wealth. And they're designed to narrow the racial wealth divide by providing the largest investment to children from the households with the least amount of wealth, which are disproportionately Black, Latinx, or Indigenous. But I do want to say that keep in mind that this goes to any family or to child from any family who doesn't have a lot of wealth, regardless of their race, but disproportionately, those are the children that they're supporting. So in terms of how baby bonds work, the government invests significant amount of money for each child. And as I said, the largest amount goes to kids from households with the least amount of wealth. And those funds are invested by the government on the children's behalf, and they grow over time. And when they become adult, those participants can use those funds to purchase an asset that's going to help to generate economic security and wealth for them, like paying for post-secondary education or purchasing a home. And over time, as we invest in children, with kind of disproportionately that money going to kids from who are Black, Latinx, or Indigenous, baby bonds will help to narrow the racial wealth divide. So now that we have that background, I want to go into a little bit about some specific baby bonds policies. You've probably heard of the proposal, the American Opportunity Accounts Act, proposed by Senator Cory Booker and Representative Ayanna Pressley of Massachusetts. This was reintroduced most recently in February. And what this proposal would do is every child who's born in the US would receive an initial $1,000 deposit into an account. And the next slide, you can see that the way that this begins to address the racial wealth divide is then each year, children receive up to $2,000 additionally deposited for them. And children from the lowest income households receive that full $2,000 while that amount goes down until children from higher income households don't receive any additional annual deposits. And then on the next slide, you can see by the time the children become adults, it's estimated between those annual deposits and the return on investment that children from the lowest income households would have over $46,000 available to them that they can then use for higher education, home ownership, or other assets. So it's really kind of giving those kids a start in life, a little bit of a nest egg to begin their adult financial lives. Of course, the status of that is, we know that Congress is fairly divided, and so it's probably not going to pass in the next 2 years, but we're thinking of this as an opportunity to continue building awareness. Now, in terms of states, I want to say that the original vision for baby bonds was a federal program, and that is still the North Star for this policy because the federal government has resources that any one state alone doesn't have. And when we think about the scope of the racial wealth divide, we really need those full resources. But at the same time, there's a lot of momentum at the state level for baby bonds. And while they're not quite at the same scale, these programs can really put aside significant amount of funds for children to begin narrowing the racial wealth divide, as well as helping to build momentum towards that federal legislation. So you can see here that legislation's been passed in a couple of places. Connecticut and DC passed legislation in 2021. Although there is some challenges, we'll say, with getting the Connecticut legislation funded. And I know David's going to talk about that more in the next panel. And then California has kind of a narrower legislation targeted towards children who lost a parent or caregiver to COVID-19 or are in long-term foster care. And then, of course, legislation has been introduced in this current session in a couple of states, of course, Massachusetts. Nevada, right now it is working its way through committee, so we will see where that ends up. New York has also reintroduced legislation, and Washington State as well, although unfortunately they're kind of have a prohibition across the state on funding new programs because of some budget challenges, so it doesn't look like it's going to pass this year, but certainly it has gotten a lot of support, including some bipartisan support. And then you can see it's also been introduced in a couple of other states in the past. So there's definitely a lot of momentum. So yes, on the next slide, you can see, as we saw a lot more states interested in baby bonds, we wanted to kind of, put out some markers out there about what are some of the essential elements, what makes for good baby bonds policy. So we worked with Dr. Derek Hamilton a few years ago to put together a report outlining some essential elements for baby bonds policy. So the first and most important is that it needs to be a substantial monetary investment. So we're not talking about a few $100s here. We're talking about at least several $1,000s in order to begin to make a little bit of a dent in that need for some initial capital that children from low-income households have. We also, of course, as we've talked about, children from lower resource households should receive higher amounts. Automatic enrollment is really important so that we ensure that everyone gets to participate who's eligible. And then the funds, because this is about addressing the racial wealth divide, the funds should be used for something that is going to generate wealth. We think that it's important to have other programs that also address people's immediate financial challenges, but for this program, it's really about generating wealth. And then it's really important that the government investment be kind of the critical feature rather than expecting that families are going to be able to make deposits. It's just not realistic for low-income families and would just end up being inequitable as higher income families could afford to make those deposits. It's important that the funding source be sustainable, being that this is a long-term program, and that families are not harmed in kind of their current financial situation by these the money in these funds being counted towards asset limits for benefits. So we have to make sure that they're excluded. So on the next slide, I just want to kind of give you a little bit of sense of how these things play out with an overview comparing the DC program and the Nevada proposal. So the DC program has been enacted into law and is in the process of being implemented, while Nevada is still a proposal. The total monetary investment in DC is $500 initially, and then up to $1,000 annual deposits, whereas in Nevada, it's just a one-time $3,200 deposit. And then in terms of eligibility for DC, the eligibility is limited to children who are in Medicaid eligible households. And then while all children receive that initial $500, there is a difference in annual deposits by income. In Nevada, the eligibility is similar to children whose births are covered by Medicaid or CHIP and all receive the same initial deposit. In terms of enrollment, both really are intended to have automatic enrollment, though I know there have been some implementation challenges in DC on automatic enrollment using Medicaid information because of privacy issues. And so that may be something that could be a challenge in Nevada if the legislation passes. Both have similar allowable uses: education, home purchase, business investment. DC does allow for retirement, which is a little bit different. And Nevada has more of a blanket statement allowing other investments that might provide long-term gains to wages or wealth. Both are subject to appropriations, which, while it is not ideal, kind of reflects the political reality, and both exclude funds from asset limits. So you can see, kind of how these different elements play out in different proposals. So with that, I'm going to conclude, and just that's my contact information. Feel free to contact me if you have any questions about baby bonds, and please visit our website for more resources. And I will turn it back to Elena.
Thank you so much, Sharon. Thank you for providing all that information, the national perspective on baby bonds. I'm thrilled to be able to move the program over to the next section, which is our panelists. And I'm so excited to introduce all of our panelists. I just want to let everybody know all of our tremendous speakers have outstanding bios, which we don't have time to get into today, but a link in the chat is being sent out so you can read about all their tremendous accomplishments. Treasurer Goldberg will be moderating today's panel, but let me introduce today's panelists. Our first panelist has a national perspective on baby bonds, as one of the most requested speakers on baby bonds nationally. So we're thrilled he was able to join us here today. And he was also part of our task force, Dr. Derek Hamilton from the New School. We also have David Radcliffe, who I've gotten to know with our work on baby bonds. He previously worked for the state of Connecticut, but he's now with the New School. And we also have our tremendous legislative champions, Senator Paul Feeney and Representative Andy Vargas, both of whom also served on our baby bonds task force and are now our Senate sponsor and our House sponsor on the baby bonds legislation. I'm now going to turn it over to Treasurer Goldberg to moderate today's panel.
I'm back, and I couldn't be more thrilled. And Shira, thank you for that really terrific overview of what's going on throughout the states. And I have kept my finger on the pulse of all this because in many cases, it's the treasurers who have been involved in this. And because this strategy is seen as a fully appropriate strategy to be coming out of treasurers' offices because of the potential of holding the resources and growing the resources, which is something that treasurers do in most states. Now I'd like to begin the panel with our first question, going to Dr. Hamilton, and welcome, Dr. Hamilton. Can you give us an explanation as to why we even have a wealth gap and why this gap should matter and matters for individuals, families, and the economy overall? How, I'm in a very religious mode with the holiday of Passover coming up. And when we tell the story around the table, we say, why does this matter to me here today in 2023? And we answer that question. What I'm asking you to tell all of us is why this matters to all of us. And what are the long-term benefits of a wealth building policy like baby bonds?
Well, first, gratitude, Treasurer. It is a privilege to be here. And it's especially useful to be in Massachusetts talking about baby bonds, given that one of the champions at the federal level, particularly in the House, Representative Ayanna Pressley, is from the great state of Massachusetts. Momentum is building, as you pointed out. There are various places across the country, including at the federal level, but even the international level, where people are starting to realize that the key ingredient for wealth is wealth itself, having some capital to put people in an asset that can passively appreciate over their lifetime. So the question that you proposed to me, why does the wealth gap exist? I think is grounded in just that, capital itself. And we need only look at data to make that case. For example, if we look at the racial wealth gap, at higher levels of income and higher levels of education, not only does the racial gap persist, it often widens, which is suggestive to me that income and education alone won't solve the racial wealth gap. They're important in and of their own self, but for the vast majorities of Americans who are able to acquire wealth, it comes about in a passive way. It comes about in that they early on in life or at some point in their adulthood get into a vehicle that wealth will generate in a passive way, like being a homeowner as opposed to a renter, like having some capital to engage in entrepreneurial activity so that however smart your idea may be, that you have some capital to bring it to market, like having a debt-free college education to put you in a managerial or professional position that affords you a 401k where an employer is providing a match. So these are the ways in which we've generated wealth. We generate wealth. And what is perhaps dastardly or immoral is if we look at our nation's history and we look at certain demographic groups, namely Black people and Indigenous people, they have not been afforded the access to capital provided oftentimes by government policy that have been afforded to other citizens. Likewise, when they were able to accumulate wealth, it was not provided the political protections in the same ways that other groups might have had political protections. But we can rectify that. And we can rectify it in a way that's inclusive of all people, that ensures that as a birthright, everybody has access to capital in a way that they can be afforded wealth. And then the second part of your question is, why is it so important? And I think the essence of wealth is not it as an outcome, but what it can do for you, the functional role of wealth, which kind of relates to the point that I began with of why the wealth gap exists in the first place. What wealth does is it provides you resources to do big, bold things. It provides you financial agency. And our conception of freedom, if we think about political freedom, civil freedom, social freedom, without resources, that's going to be incomplete. Wealth provides somebody the agency so that they can, in an authentic way, reap the rewards of their ingenuity and their actions in a sustainable way. Wealth allows us to be able to withstand shocks. For example, a pandemic. Wealth provides you the ability that if you were sick and had a pre-existing condition, that you very well would have the righteous choice to know that you shouldn't put yourself in harm's way. So all that said, I'll say that ultimately wealth is empowering in a way, not just for consumption, but to create a dynamism of economic activity, not just for individuals, but for themselves, their families, and their communities. And I dare say will mitigate some of the social harms and costs associated with not having resources in certain degraded communities.
Thank you, Dr. Hamilton. And that very much was behind many of the things that we've done in the Office of Economic Empowerment. By helping people achieve economic stability through opportunities, we felt that we are doing things to create a healthier economy overall in Massachusetts. And one of the things people like say to themselves when they aren't familiar with the issues is, well, why would we want to take X amount of money and invest it in this group of people when in fact we already are doing that? It's almost the same as the argument as to why are we providing universal health care? Well, when you're actually funding proactive health care through the emergency rooms, you're paying as a taxpayer or as a state a great deal more money to do that than creating a healthcare system that meets people's needs and prevents ill health. And that's in a very big way what this is. We're creating wealth opportunities in groups of kids that would potentially for the rest of their lives need state aid and federal aid, and it can lead to all sorts of other issues. And so we're being proactive, and very similarly to other things we've done here in Massachusetts, which is why obviously I feel we should lead on that issue. And a perfect segue to my good friends, Senator Feeney and Representative Vargas. Can you provide us with the Massachusetts perspective and tell us about wealth inequity in this state and how, from your point of view and your experience on this task force, how this act will address the racial wealth gap to help tackle this issue? It's not the be all and end all, but how directly it will be effective.
Sure,
And it's up to you guys to figure out who goes first.
I'll jump in and then kick it over to my colleague, Senator Feeney. Thank you so much, Treasurer Goldberg, for convening us and for your leadership in this space. And Dr. Hamilton's comments were spot on. And thank you to your entire team as well to put together this webinar that has worked so hard to build a coalition behind this bill. This bill can't get done without a broad coalition advocating. And so we thank all the folks involved in that coalition. Look, the bottom line is that we know that Massachusetts is a great place to live, but it's also one of the most expensive places in the country to live. We have endless opportunities here, but despite this, Mass has one of the worst rates of inequality in the United States. And the problem isn't getting better. Right now, it's actually getting worse. In my district alone, we have, I like to say, 9 golf courses, but we also have gang violence. I have precincts where median income is $27,000, right next to a precinct where median income is $175,000. So my district is living this. And many of us are aware of the study conducted by the Boston Fed, which found that the median net worth of Black households in the greater Boston area was just $8 compared to $247,000 for white households. I think for Dominicans, where my family's from, the Dominican Republic, it was $0. And that study really showed us that white households are much more likely to own every type of liquid asset out there. Of all 9 non-white groups categorized in that study, the group with the highest median wealth to average amount of wealth was just 5% of the average amount of wealth in white households. And we see these trends across the board, right? We see them in the racial wealth gap and home ownership, fewer investments in stocks and retirement savings, disproportionately high student loan debt. The data is really overwhelming, and it's very clear. These radical outcomes are not inevitable, and they're not beyond our control. We can do something about them, and that's what we're trying to do with this legislation. And so an act to address the racial wealth gap is a comprehensive, targeted approach to address this problem in a sustainable way that empowers our most vulnerable populations. And I'm personally really excited about this legislation as well. I just opened up a 529 for my kid. I got a 1-year-old. And so I'm learning this, myself. And it's something that I'm really excited to be able to pass down to, my son, but to ensure that, every child in the Commonwealth is not limited by the zip code that they're born into or the bank accounts of their parents, and that they can realize their full potential. And so I'm honored to be a partner in this, and I'm honored to be working with my colleague and esteemed leader in the Senate, Senator Paul Feeney. I'll send it over to
you. Great. Thank you so much, Representative Vargas. And the feeling is mutual. Really pleased to be able to work with you on this issue. You've been a champion of so many issues around equity. And of course, so has our Treasurer Goldberg. Thank you for everything that you do for economic empowerment and for the Commonwealth and for bringing us together. You are an organizer at heart, my friend. I know you are. and to build coalitions. You spoke about earlier in your opening remarks, building coalitions. That's what this is. It's building a coalition, not just of legislators that are going to get into the wonky business of trying to figure out how to pass legislation. And certainly, all the data that, that we're looking at is important, and trying to figure out how we make this sustainable. But ultimately, you have kept us focused, as well as the task force in your office, in focusing on the why. Why are we doing this? Why are we putting ourselves through this to really find a way to be proactive in a way that hasn't been done in the Commonwealth before? And you've heard that. Certainly my colleague, Representative Vargas, just explained how important this is here in Massachusetts. The wealth gaps in the Commonwealth are very real. We heard from Dr. Hamilton, we heard from Cher, we talk about a national perspective, but I think when people look at Massachusetts, it's important to understand that those wealth gaps are very real here in the Commonwealth. We just heard about that Fed study, $8 in accumulated wealth, $8. Now, if that's not a reason to go out and try and pass this bill immediately and start on this work, I don't know what is. I mean, that is a clear example. And I know there's some arguments either way on the data there, but you can't live in the Commonwealth and walk down the street, whether it's in my district or at Vargas's district or anywhere in the Commonwealth, and not understand that the wealth gap is real. The inequality is here, it's throughout the Commonwealth, and there are stark contrasts in wealth. Rev Vargas talked about the dichotomy in his district, and we see that across Massachusetts. Those differences, we look at them across the Commonwealth, but we start to see some trends, right? And you've heard it already a couple of times today. How important it is in addressing not just the wealth gap in general, but that racial wealth gap that exists. The inequities are systemic, they are pervasive, but they also require bold action, which is what brought us to this bill. There are many, many people in the Commonwealth of Massachusetts that are relying on just, a string of programs already to try and just pay the bills, to make sure that they have a standard of living, a roof over their head, healthcare. We do many things right here in Massachusetts. But certainly those opportunities are not available to everybody. When we talk about the work that we do around healthcare and education, the bottom line is it is inequitable. It does not work for everybody. By creating a program like this and investing from day one of a child's life, no matter what zip code they're born into, no matter what the station is of their parents, we can provide a jumpstart to those individuals who are otherwise at a disadvantage. We can begin to narrow that racial wealth gap and give our most vulnerable residents an entryway, a gateway into those opportunities that many, many others have in the Commonwealth of Massachusetts. So think about it. A child born today in Massachusetts, right up the street in one of the greatest hospitals in the world here in Massachusetts, that by the age of 18, if they're born into poverty today, by the age of 18, they've accumulated enough wealth. And again, it's not a magic wand, and Treasurer, you've said this many times, but they've accumulated enough wealth to begin college, take advantage of an opportunity that they may not have had, launch their career, start a business, take their ideas to market, do some research, become an entrepreneur, or continue letting that investment mature as they start their lives with essentially what amounts to an economic safety net, but different than what we do today. Instead of just triaging the most emergent needs to get them through day-to-day life, we're actually giving them hope and opportunity to build wealth, to take advantage of opportunities that others may have that they wouldn't have had if this bill doesn't pass. So while an act to address the racial wealth gap, which is our bill, won't eliminate these deeply rooted inequities, Madam Treasurer, on its own, this bill is one of the most ambitious yet feasible proposals we have seen in Massachusetts and throughout the country to take real meaningful steps to lift people up so that we can build wealth from the bottom up. So that is the goal of this. I know we're going to get into some of the nitty gritty on how we accomplish that in this bill, but I just want to lift up your office, Madam Treasurer, and the other panelists here who are doing this work to build this coalition to get this done. Thanks so much.
Thank you so much for thanking me. We love working with you. And I have to do a pitch here since you sort of teed me up on this, that this isn't the be all and end all, as I've said. And it fits very, very nicely with our baby step savings plan for those who are on the call who aren't aware of it, we all you have to do is check off a box on the birth certificate forms. And I hope, Representative, that is what you did, because we seed a savings account for post-secondary education, college or community college or vocational or technical training. But very importantly, it gives us the opportunity to wrap financial education around the kids and their families. So these two programs work very nicely together with very similar goals. And so this isn't right off the bat, this isn't a singular attempt to break down income inequality. It pairs up with other things that we're doing in our offices and other things happening across the state with nonprofit partners. But it is significant in what it can achieve for our most disadvantaged kids. And candidly, many of them aren't aware that the Baby Step Savings Plan exists. And this gets us an opportunity to be able to get them within our reach to help support long-term sustainable growth. Now, David, you and I both know that Connecticut was among the first to pass baby bonds. I, of course, having known Treasurer Wooden, now not Treasurer Wooden, but now Treasurer Russell, and I think that's a good part of the story today. Treasurer Wooden really drove the bus on this, and it hit some bumps in the road. However, not to be deterred, Treasurer Russell, who was elected this past year, has, after the fumble, picked up the ball and is running with it. So could you talk a little bit, because it just as in Connecticut, it hasn't been easy. It isn't really easy in any state. And so please, can you let us know what can be learned from this, and what are the kind of things you already see us doing with the recognition that it isn't always as smooth as silk? Thank you.
Thank you, Treasurer. And as a former policy director for the Office of Connecticut State Treasurer, I have a real appreciation and admiration for you, Treasurer, and your team, and all the great, important work you do. So before I talk about what we did with Connecticut baby bonds, I'll say a little bit also why we got to this point. In 2021, Connecticut became the first state in the country to pass baby bonds legislation, as has been mentioned. And it happened after the summer of George Floyd. Then Connecticut Treasurer Wooden observed that our current set of policies, programs, and resource flows were not focused on wealth generation, especially for those historically excluded from building wealth in a state with one of the worst wealth gaps in the country. Now, Treasurer Wooden wanted to push beyond the bread and butter of Office of State Treasury, as Treasurer Goldberg you're doing, to leverage relationships and resources to do more than safety net solutions, which are really important, but aren't helping families escape poverty and build wealth. So Treasurer Wooden and his team became familiar with a national baby bonds proposal and adopted it for a state context. He partnered with important community organizations, faith-based community, labor, and others, and legislative leadership, particularly from the Connecticut Black and Puerto Rican Caucus, and other key legislative leaders, helped pass with bipartisan support the authorizing legislation. And as Treasurer Goldberg mentioned, that we are still working on the funding aspect of that, and I get into a little more detail shortly. So there are three challenges and vulnerabilities I'd like to mention that you all will want to pay attention to as you continue your journey. The first is that this is a long-term investment. So some legislators may say, we won't see the benefits of this necessarily for 18 years. As you know, election cycles are much shorter than 18 years. In fact, many of you leading this charge now may not be in office when the first babies draw their share of baby bonds. So sustaining public will over a very long time is really key, sort of like running the Boston Marathon, which I think is in 3 weeks from today. And as you're thinking about the long-term investment that this is, there are also some short-term benefits that we believe will accrue that will be visible and help make the case for sustained investment. So consider, for example, we believe that near-term benefits for not just the young people, but for their families will include improved maternal health, including reduced anxiety and depression, increased family sense of hope and expectations for the future, better financial decisions today, greater civic engagement by parents, greater likelihood to pursue and complete post-secondary education, and importantly, increase trust in government. And we all want that. So that's the first challenge and vulnerability. The second is how to pay for this, right? So understanding and demonstrating these early returns will help with this second challenge, which is identifying a durable funding stream that will weather the ups and downs of your economy, administrative transitions, and other funding choices that you'll have to make. Now, this has been a challenge in Connecticut. So even though the legislation passed and a bill signed by the governor has expressed recent concerns about the funding mechanism, which we identified through state bonding. So the current treasurer and allies are considering other funding options, which include a direct appropriation and other creative sources, including tobacco and cannabis funds. And we are very optimistic that this current legislative session, that funding source will be secured. And finally, a data source, another vulnerability and challenge is the data, which may seem a little weedy, but knowing who the beneficiaries are on day one, if not before, is really important, because we don't want to wait 18 years to engage a young person and their families who will be recipients of baby bonds, because there's a real opportunity to understand and support the families who are struggling today with income and wealth challenges. And so that the data question, a lot of which is privately protected, is something that will be really important that you all figure out. So in the end, poverty is a policy choice. What's incredible about baby bonds is it's a policy solution that changes the very underlying capital system on how wealth is built for your residents. And that's good for the health and well-being of families, communities, and the Commonwealth of Mass overall.
Sorry, I was clicking on the unmute and it wouldn't unmute me. My husband is really thrilled that there's been a way to figure out how to mute me at times. Thank you, David. And coming back to you, Dr. Hamilton, can you really talk about beyond the long-term benefits of baby bonds? Describe to everyone what are some of the nearer term benefits to young people and their families that we might expect. We've always talked about with Baby Step Savings Plan that there are lots of near-term benefits, that we're not just talking about kids after they're 18 years old. And I'd love you to share with us what you know and what you've seen.
And you know, David started highlighting some of those already. And even I'll tell the story about that $8 statistic that was cited, which I think is going to link to your question, which is we worked with the Federal Reserve Bank the Federal Reserve Bank of Boston, and with that $8 statistic, there was also a campaign of taking that number to work with advocacy organizations and not give them solutions, but present to them the statistic and various options. And baby bonds overwhelmingly emerged as the policy that they all figured would be the best to redress some of the conditions that existed. And that took place all throughout Boston in that area. And you know, Anna Patricia Munoz deserves a great deal of credit for leading all of that. But my point is the civic engagement of the policy in and of itself is extremely valuable. It's not just economic resource. If we think about a community that often feels that government is not in their favor, that often feels disenfranchised, that often is not politically active. We're talking about low-income individuals who usually their interaction with government is punitive, often a fine or something like. So in a positive way, imagine what you do for families, for mothers, to let them know that you're investing in their children's future. Imagine all the positive touch points that the state can have well beyond wealth and baby bonds itself. Think about prenatal care. Think about the disparities in infant health at birth. Think about maternal health. Imagine what you can do with regards to prenatal care if you not just offer hope, you offer hope with substance. Far too often we make promises to this community and don't put proper resources behind it. So when I originally conceived of the idea in earnest, I thought of it as a mechanism that could, in some ways, divorce children from their families. So basically, irrespective of the decision-making of your family, you as an individual will have a set resource when you become an adult that offers you a chance to have economic security over your life. Well, through learning and through interaction as the policy started to advance, not only will it offer children that independence so that they can accrue resources when they become an adult, it empowers families themselves to be more civically engaged. It will offer true substance to a mother who's from a low income or disenfranchised group to now have greater capacities and belief in what the state can do, and in turn be more civically engaged to help facilitate the state to do big, bold things for the community in general. So, I don't think we should underemphasize the civic aspects of what baby bonds can do, as well as the many touch points that the state can have in a positive way with these families over the life course of that child.
Thank you so much, Dr. Hamilton. I completely agree with you. And so I really want to turn it back to Senator Feeney and Representative Vargas, because I'd like you to outline the key components of the Massachusetts baby bonds proposal. For example, who is our target population? How much will the state invest? What are the wealth building activities that it can be used for? Sort of outline the bill and some components recommended by the task force. You two can choose who's going to go first. I am not getting in the middle of that.
We'll go back and forth. I'll kick this one off, Rep. Vargas, as you let us off last time, and you can back clean up for us here.
The news is that you're both close friends, so either way, it's not going to matter to either one of you. No. We're working very closely together, as you know, Madam Treasurer, and trying to figure out the best way to go about this, certainly through the House and the Senate, respectively. Interesting, listening to Dr. Hamilton talk about this being essentially a divorce from parents, which I think is an interesting way to think about this. A lot of us try and do a lot of work, especially on this call in the space of domestic violence. And, we always talk about that cliche that we hear out so many times: break the cycle, break the cycle, break the cycle. Well, when we talk about poverty, it's the same thing, right? And we have an opportunity with this, again, regardless of the decisions made or choices made or situations that a family may find themselves in, to really target the individual. So I'm going to, in just a minute, kick it over to Rep. Vargas, talk about kind of who we envision, who the task force saw as the targeted individuals, to make sure that we are empowering the most vulnerable among us. But before we do that, Madam Treasurer, I just want to get into a little bit of the weeds to answer your question. First of all, this task force, I encourage everybody to go and read the task force. I'm sure the link is in the chat, to look at the work that was done. This was not something that was drawn up on the back of a napkin, or an idea that the treasurer had that, in a couple of days became legislation. We really did convene an impressive task force to really vet so many ideas, to look at the data, to try and figure out what works best here in Massachusetts. Can't take a cookie cutter approach to this, but there are a few themes that we see in baby bonds legislation throughout the country that we wanted to adopt. Number one, the subcommittee that myself and Rep. Vargas chaired on enrollment, eligibility, and funding. Number one, we wanted to make sure, and the task force made sure to put in their report as a key component, that enrollment in the program is automatic. So to break down those barriers to where somebody has to take a proactive approach to make sure they're enrolled, or have to go through some bureaucracy. By nature of your birth, you are enrolled in the program if you are an eligible participant. That is key to make sure that we're breaking down barriers we've seen in many other programs across Commonwealth and across the country, that it's important for an automatic enrollment if you are eligible. Number two, we wanted to ensure a large initial deposit. Now, I know people get nervous when they hear a state senator talk about large initial deposits for anything, but this is really game changing. So when designing the bill, the task force knew that the funding needed to be enough to truly support wealth building activities to justify the program, not just to take an action just to take an action, but to actually make a difference. That difference comes with a significant investment up front. That initial deposit, the more
the more that we invest initially, the more these baby bonds funds can grow to provide recipients with the highest potential for wealth accumulation by the age of 18, so that it's a difference maker. As was said earlier, many of us probably won't be in office by the time the first person actually, takes advantage of this program at age 18. But it's important that by the time they get there, that there's been enough of an initial deposit that it makes a difference in their lives. So the bill kind of outlines 3 funding options that were recommended by the task force. We said, let's have a menu of options here. So we have a low, a medium, and a high estimate. For a low estimate of how the funding will work, if the total amount of funding per child starts at $4,250, then by the time the child reaches 18, the trust will grow to approximately, and this is not set in stone, but talking approximately $10,228, right? But then you look on the high end of the estimation. That same trust, if we make a larger initial deposit, that trust has the potential to double in value, reaching approximately $20,456. Again, a number not set in stone. This is not a defined benefit, but when we look at how it'll perform over the next 18 years, by the time that child reaches 18, you would see approximately $20,456. Again, a difference maker for that child. Now, if the recipient chooses to let the fund continue maturing, and this is important because this would be potentially allowed under this program until they reach the age of 30, the low estimation for the value of the trust goes to approximately $18,368, and the high estimation goes up to $36,736. Again, significant amount of money. So what's the total cost? Well, for each of those options, for the low, medium, and high estimates, the projected costs that the task force sees for these models are approximately $4.25 million on the low end, $6.5 million in the middle, and $8.5 million per 1,000 children, respectively, on the high end. So that gives you an idea of the projected cost. Now, it's important to note that the task force did recommend a minimum choosing the medium option. Again, at a minimum, which has the potential to bring the total endowment at 18 to almost $15,000. So, and that factors in, current rate of inflation, which we know is on a bit of a roller coaster. And then, of course, a 5% rate of return using best practices, trying to figure out what this fund will look like. And then I want to add finally, before we kick it over to Rep. Vargas, talk about the targeted population, that financial engagement and education is paramount, just like everything that the treasurer and her staff and her team at Treasury have been doing. Financial education is key to this, to ensure that we are breaking that cycle of poverty, and including things like a community advisory committee, which is written into the bill, consisting of agencies, school systems, resource providers, community-based and grassroots organizations, among others, so that they can convene a statewide network of support to make sure that we're connecting resource providers to baby bonds participants and their families. And then the bill also acknowledged the importance of community engagement to facilitate regular community outreach, to make sure that people know that the program exists and what they can expect if they are eligible when they turn 18. So it's important to note that any balance in a designated beneficiaries fund also will not count as an asset. We heard that earlier from Shira, how important that is when determining eligibility for other public benefits or service. We don't want to replace here. We want to add to. We want to build wealth. So with that, I want to turn this over to Representative Vargas, who can get into a little bit about who would be eligible and what it would mean to that population.
Thank you, Senator Feeney, and fantastic presentation. I can call you Professor Feeney after that. Really appreciate you getting into the weeds. Look, this is very targeted towards low-income individuals. I think it's important for folks to realize that the task force was very thoughtful about this, and also recognizing the fiscal environment that we're in as well. We wanted to make sure that this is a targeted program to low-income individuals, and that it's concentrated on breaking the cycle of poverty in our state. In terms of eligibility, as the senator said, all babies born to families who are receiving benefits from the Department of Transitional Assistance and our children under 1 year of age who are in foster care are going to be automatically enrolled in that program. I actually just visited my cousin who had a baby 2 weeks ago and asked them about the Baby Steps program, and they had no idea, right? And they probably were presented with the information in the hospital, But in the hubbub of, having a child and just trying to get out of the hospital, it can be very challenging to kind of figure out what you're signing off on. And so this automatic enrollment piece, I think, is really important for all families that are eligible. Allowable uses of the fund are wealth building activities, including buying a house, starting a business, paying for college, saving for retirement, or any other asset enhancing activity. I think it's really important that, yes, college be a portion of this, or one option that can be used as an allowable expense. But as we know, there are different avenues for folks to build wealth. And increasingly so, we're seeing young people turn to other avenues to build wealth aside from college. And so it's incredibly important that we keep that door open as well. So I'll stop there, because I think Senator Feeney, you did a great job of getting into the weeds, and we can continue with a couple other questions. Back to you, Treasurer Goldberg.
Well, we're going to be doing more of these sessions, so I will make sure we keep things even on this. No, actually, Senator Feeney, really good summary of the strategies, and I appreciate both of you for what you're doing on this. We're actually getting very close to the end, and we had a few more questions left, but in general, because there were questions about how do we prepare children to be at adulthood able to do this. What I just want to quickly say is we're creating support and resources for these kids and interim programs and engagement. But I would like to turn it back to well, before I do, I would like to make a final comment and then let you, Elena, close us down. The whole idea of a healthy economy and a healthy community goes hand in hand. Lack of wealth, lack of opportunity creates so much of our social ills, not just in this state, but everywhere. And for me, it isn't just proposing a baby bonds program. It is baby steps. It is women empowerment. It is local ambassadors. It's digging into and creating programming through the kind of public-private partnerships that we often do in the Office of Economic Empowerment, or engaging the state in programs that are going to be successful and effective. And so I thank all of you for joining us today and hearing the kind of work that we have been engaged in, and recognizing that we're all in this for the long haul. One of the comments that was made earlier, and I think it was by you, David, I think it was you, David, about politicians come and go. That's one of the reasons that I am now the second longest serving treasurer in the history of the Commonwealth. And as I joke with people, Bob Crane was there about 27 years, and it's doable. But one of the passions I have is staying with all these programs till we are able to effectuate change. A very passionate commitment to this, and along with all the other roles that we do in my office. So Elena, I'll turn it back to you to go over quickly next steps. And thank you everyone for attending, and thank you to our wonderful panel, because working with you is a true pleasure.
Thank you everyone for attending today. And again, I want to just thank all of our fantastic speakers for joining us here today. Shira, Dr. Hamilton, David, Senator Feeney, and Representative Vargas, thank you again for sharing your insights and thoughts and expertise on baby bonds. We look forward to working with you throughout the legislative session. Again, the bills are Senate 1999 and House 1157, and it's an act addressing the racial wealth gap. Our contact information is on the screen. So if you have any questions, don't hesitate to reach out to us. The Office of Economic Empowerment is always happy to answer any questions. I know we had a lot of questions today in the chat. So if you didn't get your questions answered, don't hesitate to email us. Thank you again. To stay up to date on baby bonds here in Massachusetts, feel free to follow us. We like to say that we're social, and all of our social handles are on the screen. So thank you again. And this session will be available on YouTube. We'll have that posted probably later today. So thank you and have a great day.